I've now got my next brilliant guests who are already in the room. You can't see them yet because they've not turned on their cameras, but I'm going to swap pieces of paper and come to my next awesome guests. I didn't check any pronunciation of names beforehand, but we have Olga and Victoria, who are both here now as well. Hello, Olga and Victoria.
Hi, Adam.
Why don't you go ahead and introduce yourselves while I turn on the caption that tells everybody who you are.
Shall I start?
Olga, yes. I should have just prompting you. Go on, Olga, you go first.
Hi, everyone. Thank you, Adam. Thank you for having me today. I'm Olga Borejko. I work as a project manager at Old Age Psychiatry, King's College London, and I'm also a part-time PhD student at Exeter University.
And how about you? Oh, no, just at the wrong time. Victoria lost connection. Victoria will be back, I feel sure, in a second. Well, while we're just waiting for Victoria to get back in, there she is. Did you have a little panic then, Victoria, when you went? Did that stress you out? You're back. Did you not know you left?
I did know I'd left. I technical problems.
Just
sorry.
at that moment. Go on. No, that's perfect. Actually, that's our first technical problem out of the way. I feel we can tick that box now. It's when I panic when everybody doesn't join or when you can't hear them. Why don't you introduce yourself, Victoria? Because you're over in Bristol. Not too far.
I am in Bristol. Yeah. Hi, I'm Victoria. I am a research associate. I work at the University of Bristol. I'm based at Southmead Hospital at the Bristol Brain Centre. I started working in dementia research sort of as a full-time job October last year. So probably a new one compared to a lot of the veterans around here.
So what did you do before? Are you a clinical person? Are you a...
No, so I've done a little bit of dementia research before, but I also did some mental health research. So my background's in neuroscience and psychology. And I've also done, I took a break out from mental health and dementia research to do some COVID research during the pandemic and then came back.
Fantastic. Well, thank you both so much for joining us. This session, do you know what? I really struggled to come up with the titles of these sessions, but this session is called Clinical Trials, Lewy Bodies, and What Sleep Can Tell Us. Because Olga, I think you work on clinical trials, right?
I do indeed.
Which is a hot topic this week, of course. Was that a trial that you ran at
No. We unfortunately we have not been we have not been included in the lenakamab trial, but we are doing, which obviously very exciting news regarding very groundbreaking news, but we do have some anti-amyloid vaccine trial as well, which is very exciting.
Which some of our listeners, just a reminder, who might be joining, who are interested in participating in trials, we'll talk to. And Victoria, you work on sleep and circadian rhythms.
Yes, yeah. So we do. Yes, you did.
Well, I do. Don't tell me now. Why don't you do your introduction? Why don't you tell us about your research rather than giving me a little quickie now? Tell us all about your work properly.
Yeah, okay. So the focus, so our team are mainly focused on sleep. So we're looking at sleep mainly in observational studies. So a bit like Chris and Jane said, a lot of research it's not always drugs. So we're actually not looking mainly at drugs at the moment. We're trying to learn about sleep, and we're trying to learn about sleep in two sort of main conditions, so Lewy body dementia and Alzheimer's, and trying to look at differences between the two, sort of where hopefully future interventions could be placed. And we're also looking at that sort of those conditions in the earlier stages of the milder forms of dementia and also mild cognitive impairment. So the main ways that we're actually looking at that is, so a lot of the time sleep research, people kind of imagine that they've got to come into a clinic, have loads of wires put on themselves, be sort of sleep in a really strange place. And we're trying to kind of change that and shift that to more allowing people to do sleep research in their own home. So with a variety of bits of tech, so from anything sort of from a smartphone to wearables, so sort of headbands, watches, and really trying to see that is hopefully a valid way of measuring normal sleep over a long period of time compared to kind of the standard way it's kind of taking someone to a sleep clinic and looking at them really in depth, but only for one night. And that can be quite a stressful experience for people. So yeah, that's kind of what our research is trying to see, is it feasible, and do we get good results from sleep research in the home?
So does that involve things like, I've seen these where you put the pads underneath the beds to check movement? I went to something at the UK Dementia Research Institute recently. I was looking at that. So
that is one of them, yes. So that's kind of cool. I think that's called a nearable. So there's kind of there's different things. We don't use that one in particular. But yeah, that definitely is, that looks at kind of movement in the night. So that is something that we're interested in. So there's one, which is the one we're using at the moment, is an EEG headset, and it kind of has some sensors around the forehead and some sensors just at the back. And other than that, it's wireless. There's nothing kind of hopefully too uncomfortable, and that can give us a really good understanding of how deep someone's sleeping, when they're waking up, kind of the different stages of sleep that they're going through, sort of restlessness in the night, and all that kind of thing. So it's quite a lot of information that we can get from increasingly simple bits of tech.
And what kind of people are participating in that research? This isn't people living with dementia, is that right?
No, it is.
It is.
So,
okay.
Yeah, so we have, we do have people who don't have cognitive impairment, but we also have people with mild cognitive impairment, MCI, or mild dementia, and that can be kind of early dementia, or it can be kind of a slow progressive one that people are just sort of still kind of able to take part in the research, is essentially what we're looking for. And yeah, so Lewy body and Alzheimer's disease, but also Parkinson's disease dementia as well. It's like sort of kind of often lumped with Lewy body dementia as a condition. So we recruit both. And
because sleep information on its own, interesting enough, but I would imagine you have to combine that with other stuff, right, to build up that kind of bigger picture. So how does that fit into the other, let's say, data collection, but how else do you kind of work with people to make that bigger picture?
Yeah, so the main thing we're looking at the moment is the link sort of both kind of overall, but also kind of day to day on someone's sleep and on their memory and their cognitive function. So when someone starts a trial, starts in the study, we'll bring them in for sort of your standard cognitive assessments. So we'll get kind of a good baseline of where their cognition is at and the sort of specific parts maybe of memory or attention that they're struggling with. Then we will sort of also look at mood, which is a really big impact on sleep, as well as sort of vice versa. They both really impact each other. Measures such as apathy. We're also doing blood biomarkers, which I know is a topic later, which is great. And then so we monitor people's sleep over the course of 8 weeks, and we ask people to do some memory tasks with us, sort of looking at that, and then look at sort of really specific parts of their sleep and their sort of sleep architecture. And we also ask them to do sort of weekly cognitive tasks online. So we're really trying to make the most of tech. So they'll do really simple memory tasks, or kind of searching for a specific object and trying to remember where something is. So yeah, we're trying to combine it and see, okay, is a good sort of generally good sleepers, is there a link with cognition? Also people who've kind of got sleep conditions, but we're kind of what we're expecting to see is the particularly poor night's sleep is having a really big impact on their functioning the day after. And if there's a way we can kind of improve sleep, when we got dementia, it might be helpful.
Do you find that's cumulative as well? Because you mentioned then, like, okay, so So your research could tell you if somebody has a bad night's sleep, like how that's going to impact them in the short term. Does that accumulate over time? If you end up being a bad sleeper, not just for a night, but for a week or a month, or you're always a bad sleeper, is that part of your research as well, to look at what the impact on the brain is of long-term poor sleep?
Yeah, so that's kind of what we're interested in. So the theory behind, particularly in Alzheimer's, is that there's a lot, what we're trying to test is that there's a loss of, it's called compensatory sleep. So someone without cognitive impairment and without a sleep condition will generally, if they have a bad night, the next night or the night after, they kind of make up for it, and they'll have, so if they're missing really deep sleep in that night, they're really restless, they'll have more deep sleep the following night or two. We think that that will be that's not going to be there. We think that they're kind of, it's not kind of, that homeostasis isn't working quite as well. But the theory sort of behind why we think sleep is really important in dementia is because a particularly deep sleep is associated with clearing amyloid and toxic waste and kind of in the brain, and helping to kind of maintain cognitive function. So people think of sleep as sometimes quite inactive, but it's so necessary for brain health. And there's a lot of kind of different conditions that interfere with particularly deep sleep, but just sleep in general, that are now kind of considered a risk factor for dementia and cognitive impairment.
Thank you. Do you know what? I'm going to come back to you in a second. I'm going to give you a chance to think about an answer to this question, which is for anybody who's listening who is a poor sleeper. What, if anything, you've discovered from your work so far that might help people change? So you have a think about that while I go to Olga. Olga, tell us more about your work, because I clinical trials, as we started, hot on the topic, and of course Lewy Bodies is one of the brilliant charities that's going to be benefiting from anybody's donations today. Reminder, chatathon.uk/donate for anybody that wants to make a donation. In fact, why don't I just pop a reminder along the bottom of the screen there while you tell us about your work?
Okay. So the last 8 years I spent setting up and managing a portfolio of clinical studies and commercial clinical trials for people with Alzheimer disease, Parkinson disease, dementia, and dementia with Lewy bodies. So besides generally setting up and managing the studies, I also recruit patients into studies and complete neuropsychological assessments with them. So currently the studies I'm involved in at Old Age Psychiatry with Professor Doug Osland is ENLIST, Abate, and EPND study. So very briefly, ENLIST-UK study is a longitudinal biomarker study funded by Alzheimer Research UK, and the study is currently in its 4th year of extension, and we have 5 sites at which the study is carried out at UCL, KCL, Exeter, Cambridge, and Newcastle. And the study is looking at how we can improve diagnostic and prognostic biomarkers for patients with dementia with Lewy bodies, and particularly we are interested whether the presence of clinical symptoms, but also blood and cerebrospinal fluid biomarkers are associated with the rate of cognitive decline, accelerated rate of cognitive decline that we see often in patients with dementia with Lewy bodies. So the other study is the Abate study, which is equally very exciting. Is the anti-amyloid study, is funded by AC Immune with Professor Johannes Streffer in charge of the study. And it's a double-blind, which means that patients and researchers are blinded to treatment allocation, placebo control, so patients either receive treatment or placebo trial that uses an optimized liposomal vaccine to target amyloid beta plaques in the brain in patients with mild cognitive impairment due to AD, also known prodromal AD. And very lastly, the last project, but not the least, equally brilliant, is the EPND project, which is funded by the IMI Innovative Medicine Initiatives, and involves a large European collaboration of commercial and academic partners under Dr. Peter Weiss at Maastricht University. And EPND stands for, as mentioned, European Platform for Neurodegenerative Diseases, and it aims to build this big European universal platform, which will enable us to share high quality samples and clinical neuroimaging data, and also hopefully help with the biomarker discovery and future treatment development. And currently we have I'm very pleased to announce we have over 60 plus cohorts joining the platform, covering different disease area: Alzheimer disease, Parkinson disease, and dementia with Lewy bodies, and they all listed on our catalog, which is also now live. So we are all visible to research community. So yeah, these are the very kind of a broad range, but yeah, very, very exciting projects.
No, they're all fascinating studies, and I mean, we should add as well that won't be all that King's is doing. That's in the little bit that you work at King's College London. That there will also be other people in other institutes at King's doing a whole different range of different things as well.
Absolutely.
Which is amazing. You mentioned the word biomarkers a few times there. For the benefit of those that don't necessarily know what a biomarker is, can you maybe tell people what you mean by that?
So biomarker refers to a biological marker that is, for example, found in blood or cerebrospinal fluid, or also can refer to a neuroimaging marker, and they are generally associated with, they're either prognostic or so they predict the disease, or they can actually predict the progression in certain disease.
I'm typing a reminder to our audience in the chat box while you do. I wasn't ignoring you, sorry. Just to remind people that if they have any questions for Victoria and Olga, don't forget you can post them in the chat. I will also try to remember to regularly check hashtag Chatathon on Twitter for those of you working in Twitter, if any of you have any questions. So what else was I going to ask? So that's a good reminder that actually some of the studies that are taking place we have this term interventional and non-interventional, don't we? Because some studies, I guess, will be hoping to test something on people to say, hey, is this something that can improve you, or is this something that can help you, or is this a way to help reduce your symptoms perhaps? But then the non-interventional studies, which I'm guessing, certainly it sounds like some of those you're working on, Olga, are. Victoria, I'm going to come back to you. You can tell me whether yours is interventional, but we'll simply be collecting information from you. So again, a reminder for anybody who's watching who might want to, I won't say exactly how old I am. I am over 40. God, that says I must be embarrassed by it, mustn't I? I won't tell you exactly how old I am. But I mean, I participate in a dementia trial. So I'm a participant in a study called Prevent, which is run at Imperial College, and I think it's in Oxford and other parts of the country now, where I go every couple of years and they do an MRI scan and they ask me to answer a bunch of questionnaires about my lifestyle. I do cognitive tests. They take my blood and check my weight and height and do these physical things as well. And so all of those studies, this is to capture what we call longitudinal. So this is information from people over a long period of time. So you can then, I assume, answering this for you, look back at that information. So if I go on to develop dementia in the future, you can look back and go, oh, that's how that person differed from somebody else. Because that's, at the moment, we still don't really know. Whilst we're learning more, we still don't know entirely what all the causes are. So why don't you tell us what are the purpose of those biomarker studies and those that you're talking about? What do they aim to do?
Well, I think you've described very well. You've answered for me. So essentially, we are looking at a different range of biomarkers associated with also, like in dementia with Lewy bodies, with different type of pathology, because you have the alpha-synuclein pathology, the Lewy body pathology, and also we know that patients with dementia with Lewy bodies and Parkinson's disease dementia have also brain changes similar to those seen in Alzheimer disease. So essentially, we're looking at biomarkers associated with both type of pathology and see whether they can predict someone deteriorating a bit quicker throughout the course of disease. But of course, we're also looking at the clinical picture. So we're looking at people's cognitive function, memory, attention, visual spatial processes, also other clinical features that you see in dementia with Lewy bodies, like visual hallucination, Parkinsonian symptoms, also REM sleep behavior disorder that you see in patients with DOB, and how these are all connected and whether they predict the rate of cognitive decline. And yeah, I think we're just trying to gather as much information as we can over time and see what we can deduct from it.
And we've just got Victoria back. Phew. As I was about, thank you, Olga. I'm going to come back to you, Victoria. You've had time to think about the answer to your question. We've also had a couple of questions in the chat as well. So why don't you, first of all, answer that question about what do you think can improve people, or what, if anything, have you learned? Is your study interventional or non-interventional, and what have you learned that can improve people's sleep?
Yeah, so the main studies we're doing at the moment are observational, so they're not interventional. So we're really trying to look at people's kind of natural sleep, because there's been quite a bit of research about kind of how people feel about their sleep, so asking people questions, but it's really, really hard to know how well you're sleeping. So if I asked you how long you were awake for last night, that's actually quite a difficult question, because you're kind of not really thinking about it. And we don't want people to be overly kind of really over-focused on their sleep, because it will make it harder to sleep. So that's kind of why we're doing all the kind of the more like using and taking advantage of this tech to monitor people's sleep and give us a lot more information. But we are going to be doing a study soon, which is looking at the effect of dopamine on sleep. So it's a really kind of well-tolerated drug, only overnight, and just to see actually, does that change how people sleep, and does that improve particularly that slow wave, really restorative sleep? So that's sort of coming soon at Southmead. In terms of what we've kind of learned, so anything that so we would say don't worry about your sleep is the biggest thing, which I know that is difficult when we're saying that there is a link, but essentially look at if you're having problems with your sleep, it's worth having a think about and having a research into something called sleep hygiene. And what that is essentially having daylight exercise or exposure to daylight in the sort of early part of the day, and particularly early afternoon, early morning. That can really help kind of your brain to register the time of day. So with artificial light, it's quite difficult for your brain and your body to understand what time of day it is and when you should be sleeping and when you shouldn't be, particularly with blue light coming from tech in the evening. That can kind of be a bit difficult for your brain to go, oh, I should be sleeping now. So lots of light in the day, sort of early daytime, less light at night if you can, is great. Avoiding caffeine and alcohol at night. Alcohol does not help you sleep, no matter what someone will tell you. It will be you might get off to sleep, but you'll have broken sleep. So try and avoid that if you can, or don't go overboard. So one of the things that we're sort of realizing is that sleep apnea seems to be, so that's when you stop breathing or you have breathing obstruction during sleep, does seem to be linked to both sort of short-term sort of fuzziness, like cognitive fuzziness, but also impairment over a long period of time. So if you feel that if someone's told you in the night that you seem to stop breathing or you're snoring really heavily, that could be something to speak to your GP about, because it's treatable.
Yeah.
It's very, very treatable. And that could make you generally make you feel better in the daytime. If you're really, really sleepy during the daytime, again, it's probably worth chatting to your GP and saying, do you know if there's anything that's causing this? Is it worth having a general look?
I think, is it worth as well, would you recommend people do things like use the Apple Watches or what's the other one that I'm thinking of? The
Like
Fitbits and
yeah.
things like that, because that can give you a clue. And I've just realized I have this ability this is new stuff to me. I can show you one of the questions that we've had. Did you see it pop up on the screen?
I haven't got it on Zoom.
Oh, it's not. No,
on...
sorry, it's in the live stream. So we've had a question come in that says, what do you think about using things like music and herbal remedies? And then the second question, which is, could Alzheimer's disease progression be improved through sleep? So what do you
so in terms so we've got 3 questions there. So using Fitbit and Apple Watch, things like that, I think that's personal preference. Some people find that if they try and analyze their sleep too much, they're led there worrying. If that is you, do not do that. That's not helpful. They're getting much better, but they're not sort of research validated or sort of necessarily clinically validated, all of them. So they give you a good guess. They are not going to be the same as having a sleep study. So it can be worth it if you think, you know what, you're really restless in the night, then maybe something to talk to a doctor about if you're worried. Herbal remedies, music, things like that. It seems at the moment there's not like a massive amount of evidence compared to other things, so like avoiding caffeine and alcohol.
Yeah.
But if that works for you, if it's something that kind of calms you down enough to help you sleep, then I think that's great. I think it's very individual. So we're doing some research at the moment. We're launching a 3rd wave of a study that's actually looking at techniques people use to get to sleep during COVID and now, and seeing if there's a difference and if any of those seem to predict better sleep. But there's not a massive amount of evidence that I can see. It seems quite mixed.
So if it works for you, keep doing it. Thank you, Victoria. And Olga, just before, because I want to come back to you and just what would you say to anybody that wants to get involved in a clinical trial that isn't necessarily kind of at the moment visiting a memory clinic regularly? How would you suggest they do that? And the perfect gentleman's just joined, who of course is very passionate about that same topic, is participating in clinical trials. What would you say to anybody who's doing that, Olga?
So as you mentioned, we recruit our patients through our local NHS trust and so anyone who comes through memory clinics and say yes to research is being approached by us. But for those who would like to join our studies, they can contact us via Join Dementia Research. It's a UK-based platform where people can register their interest in studies, and both the ENLIST-UK study, which is the observational study in DOB and PDD, and also the anti-amyloid vaccine study, Abate study, are both there. So please do register your interest, and we will be able to contact you fairly quickly and invite you to take part in our studies.
That's perfect timing, just as we hit 10 o'clock. And a great reminder for anybody who's listening, wants to participate in research. Of course, we would love for you to donate at chatathon.uk/donate. But if you can't afford to donate, one thing that everybody in the UK can do is go to joindementiaresearch.nhr.ac.uk. With and without dementia, it doesn't matter whether you're 18 or 80, everybody can sign up on there. It asks you a few questions about your health and your demographics, and then at the end of registering, you'll see if you match to any studies, and you can set alerts, so it'll send you email if you match to something new. There's no obligation to participate in anything, but it does mean that brilliant researchers like Victoria and Olga can find you and get in touch, share their information on their studies, and give you an opportunity. Thank you very much, Victoria Grace Gabb and Olga Borejko. I had to go at your surname in the end.
You've done a great job.
Thank you so much, both of you, for joining us today, and we'll see you again soon.
Bye.
Thank you. Bye.